Welcome to this latest video from Dental Edinburgh, the friendly dental practice. We're on the website here, dentaledinburgh.co.uk, and you can see about Dental Edinburgh. And we're going to go on to Don't Be Afraid here. Now, in my last video, I covered fear of dentists. I went into fear of dentists, how many people have this, how real it is to so many people. But in this video, I want to go into some of the causes of fear of dentists. A recent survey by the British Dental Association found that 25% of people, that's 25% of people, were afraid of visiting the dentist. Some people blame the cost because it's easier than saying they're frightened, said a leading specialist in sedation and special care at King's College London. Now you can see we're on, let's go to Don't Be Afraid, that might help. Now, as with any type of anxiety, there are varying degrees of fear of the dentist. The most common and least severe is simply a fear of the unknown. This may arise if people have heard horror stories from other people or they're worried about what could happen. The next level is dental fear. Dental fear is a reaction to a known danger. For example, somebody may have had a tooth removed, experienced some pain, had a little bit of pain when they had a filling done in the past. As a result, they may worry about experiencing this again. Moving on to a higher level of fear, dental phobia. Dental phobia is similar to dental fear, but it's much more severe. It's often the result of bad past experience. For some people, dental phobia can be so crippling that simply seeing a toothpaste advert or a dental surgery can cause distress. Now, I touched on that a little bit in the previous video. Visiting the dentist when you have a phobia. If you need dental treatment or want to register at dental surgery, the first thing to do is find a suitable dentist who can help with your phobia. If you've got really bad fear, you should find an understanding dentist. Ask friends and family if they can recommend one, or look for someone who advertises themselves as dealing with anxious patients. You should also look for a dentist who specifically offers a sedation service if you feel that may be required. Hopefully it wouldn't come to that, but it's quite nice to know that the option is there. Once you've found someone you think may be suitable, phone or visit the surgery. Tell the dentist that you're anxious so they know beforehand. When you're at the surgery, a dentist will take a history to find out why you're so frightened. They'll work out what needs to be done and explain this carefully. Your dentist should be sympathetic and prepared to spend time. That's key. Spend time explaining things to you and making you feel at ease. Here are some reasons behind the fear. Bad childhood experiences. Fear of needles, fear of anaesthetic, fear of the dentist drill. I know that was the fear for me, the noise, the sharp noise of the dentist drill. Lack of control. You're not in control when you're in the dentist chair. You lie back and the dentist does his business. Feeling vulnerable, invasion of personal space. Here are some of the techniques that should be used by staff in a good dental practice. First and foremost, they should be good at listening carefully. They should have well-developed communication skills, empathise and motivate you. These type of emotional skills, in addition to clinical expertise, are vital. They should have patience. They really need to be able to spend time with nervous patients and progress you patiently. You want dentists who are experienced at dealing with vulnerable and frightened people. Breaking down barriers. Sometimes the dentist will gradually desensitize the patient to a particular treatment. This is done in a sympathetic, supportive environment. For example, if fillings required, the dentist will carefully expose you to what the treatment involves. This technique is used to treat other phobias as well. For example, if someone has a phobia of spiders, they'll be shown pictures of spiders, and gradually, over a number of weeks, the spider will be walking over the hand. Desensitization, it works with dentistry as well, and believe me, I've been there, and this is what actually helped me. They'll set you some targets, so each week you can do a little bit more. It's called cognitive behavioral therapy. Small targets and challenges which help change your attitudes towards dentistry. And final, if it comes to that, sedation, but hopefully it won't. But these are all things you can check out. Look around in your local town for here at Dental Edinburgh, these services are available. Ultimately, the aim of any good dental service is to get people seeing a dentist again. A good practice should treat people who fall out of the dental healthcare system and try to get them back into it. Do hope you've enjoyed the video. Watch out for the next in the series of videos coming up shortly. Thank you for watching.